Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.
It's Tuesday, October 5th. This is The Gateway. I'm Wayne Pratt. The leader of the country's Medicare and Medicaid programs believes expanding Medicaid in Missouri could fundamentally change the lives of the working poor.
It means mental health coverage, so being able to see a provider if you're struggling with depression or postpartum issues.
Medicare and Medicaid Services Administrator Chaquita Brooks-LaSure talks with St. Louis Public Radio's Jason Rosenbaum in just a few minutes. A new report finds more than 1,300 people in St. Louis County died of COVID-19 last year. That's 11% of all deaths in the county in 2020. St. Louis Public Radio's Chad Davis has more on the report from St. Louis County's Department of Public Health.
COVID-19 was the third leading cause of death for county residents in 2020, only behind heart disease and cancer. County life expectancy dropped by 2.3 years. The report also noted that Black residents were more than 2 times as likely to die of COVID-19 than white residents. Spring Schmidt is deputy director for the county's public health department. She says the region needs to eliminate those disparities.
We still will be talking about additional investments that will be necessary from other community partners, from hospital systems, from federal and state sources, as well as a concerted effort to address other social determinants.
Schmidt says she expects fewer COVID-19 deaths in 2021. I'm Chad Davis, St. Louis Public Radio.
Advocates for people in foster care in St. Louis say more young adults could be in need of housing and financial support. A federal moratorium that kept young people 21 and over in the foster care system during the pandemic expired last week. Epworth Street Outreach Services Vice President Natalie Allen says the change will be difficult for young people still trying to figure out how to make it on their own.
So, we know that adolescent development extends into mid-20s, and all that means is that our brains aren't fully developed and that we need support in developing life skills and making safe and wise choices for our lives.
Allen says people leaving the foster care system will need support from employers and others. The state of Illinois will no longer contract with businesses or nonprofits that pay workers with disabilities below minimum wage. It's legal under federal law to pay workers with developmental disabilities less than minimum wage, which can be as low as $1 an hour. Governor J.B. Pritzker has signed an executive order ending that practice for employers with state contracts.
Sub-minimum wages need to go away, not just because of the inequality, it's also about dignity. The dignity of being paid a fair wage, the dignity of having your work fully valued.
Dozens of vendors provide janitorial and other services to the state via work programs for the developmentally disabled. Advocates are calling for lawmakers to fully abolish the practice of paying below minimum wage for all workers with disabilities, which has already been done in 8 other states. Missouri Governor Mike Parson says the state plans to carry out today's execution of a man convicted of murdering 3 people during a robbery in 1994. Nomin Ujiyediin has more.
Advocates for 61-year-old Ernest Lee Johnson have claimed he's intellectually disabled and should not be executed. They say Johnson had fetal alcohol syndrome and had part of his brain removed due to a tumor. Last month, the Missouri Supreme Court ruled that Johnson is not disabled. Pope Francis and Missouri congressional representatives Emanuel Cleaver and Cori Bush are among the people who called on Parson to stop the execution. The governor says Johnson's claims have been reviewed 6 times and that he's received due process under the law. I'm Nomin Ujiyediin.
Missouri is the 38th state to deliver Medicaid expansion to the working poor. People making up to roughly $17,800 can now access the health care program. U.S. Centers for Medicare and Medicaid Services Administrator Chaquita Brooks-LaSure spoke with St. Louis Public Radio's Jason Rosenbaum about the dollars and cents of expansion.
17,000 people have signed up for Medicaid since people in the expansion population could start applying in August. What is the federal government going to do to get more people who are eligible into this program?
We are so excited that Missouri has expanded healthcare coverage in the state and expanded the Medicaid program. What we've seen over the last year is that outreach and education makes a huge difference. And so as part of that, we are encouraging everyone to know the rules have changed, that they should go to Missouri, covermissouri.org/help to find out if they are eligible for coverage. And we are strongly working with the state to continue to help get the word out that people can now enroll in coverage.
Missouri is going to be getting an estimated $968 million over the next 2 years from a bill known as the American Rescue Plan for implementing expansion. What could the state spend that money on?
So the state will be able to, as part of the American Rescue Plan, states now who have expanded coverage get additional funding to cover people. And so the cost to the state for the expansion are really minimal. And so the state can use use the federal funding to actually cover people and encourage and really encourage people to enroll.
So, for example, because expansion 90% comes from the federal government and 10% comes from the state, Missouri could hypothetically use the $968 million to pay for the state match. Is that correct?
Yes, in the sense of basically 95% of the costs are covered for Missouri. So the money goes straight to covering the newly eligible individuals, and the state doesn't have to put up that funding.
One of the reasons why Medicaid expansion took so long to get across the finish line is that Republicans in Missouri have argued that even if it doesn't cost that much on the outset, it's going to be a long-term financial drain on the state. What assurances can you provide not only to policymakers but to Missourians that this is going to be a good deal in the long run from a budgetary perspective?
I would say that what we've seen in the last year and a half is the price that we pay for not having comprehensive coverage in our country. And it is so important that we remember the work of the Affordable Care Act. We believe, the Biden-Harris administration believes, that healthcare is a human right. This is so important to make sure that people have access to coverage so that they are healthy and can get access to vaccinations and treatments. And health coverage shouldn't be a partisan issue.
If somebody hears about Medicaid expansion and they eventually sign up, what are going to be some of the benefits that they're going to get compared to maybe the status quo where they don't have insurance?
It's such an important question about what Medicaid coverage means. It means things like being able to go to your yearly checkup and making sure that you are getting treated for any underlying conditions. It means having access to care if you have diabetes, access to drugs, access to insulin, access to seeing your providers. It means mental health coverage, so being able to see a provider if you're struggling with depression or postpartum issues or any of the host of issues that can come up over the course of someone's lifetime.
That was U.S. Centers for Medicare and Medicaid Services Administrator Chaquita Brooks-LaSure discussing Missouri's Medicaid expansion with St. Louis Public Radio's Jason Rosenbaum. Our Fred Ehrlich edited that report. Shula Newman is the executive editor of St. Louis Public Radio, a listener-supported service of the University of Missouri-St. Louis. Music by Ryan McNeely of Adult Fur. I'm Wayne Pratt. This has been The Gateway.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.